Hi, I'm Abby, and on behalf of my teammates Molly, Margaret, Carly, Shyla, and Lily, we're really excited to share our idea with you today. What are you eating for dinner tonight? Maybe you'll stop at the farmer's market or grocery store on your way home. You'll pick up some fresh veggies, some chicken, bring it home to your kitchen, and prepare a lovely dish. You'll gather with your family around the dinner table and enjoy this delectable home-cooked meal together. Or maybe you won't. Maybe you had to stay late at the office or at work. You're tired, you're hungry, but you know that the fridge is empty, and the last thing you feel like doing is going to the grocery store and trying to figure out what to cook. Through our research and interviews with more than 30 people of different socioeconomic backgrounds, we heard these pain points around dinner time. Finding a new recipe, coming up with a shopping list, getting all the way to the store, hunting down ingredients. They're time-consuming and inconvenient. Low-income families are disproportionately affected by these challenges. Families making less than $40,000 a year go to the grocery store significantly less often than higher-income families. Low-income families are also more likely to live in food deserts, far away from the store, making it harder to access fresh produce. Despite these challenges, we were surprised to learn that many families are making dinner on a regular basis, up to 5 times a week. They said that cooking is the most economical option, and they feel proud of the dishes that they create. But when they can't get to the store often, they rely more and more on pre-processed ingredients or frozen dinners. The nutritional quality of these meals has gotten worse and worse, contributing to the rise of obesity and chronic disease. So how can we make it easier for low-income families to access what they need to cook fresh, healthy meals on a regular basis? Our solution is Chop Chop, a convenient grab-and-go dinner kit that walks you through what you need to cook a simple, healthy meal. Each kit contains 2 or 4 portions of a 30-minute or less recipe and the fresh seasonal produce, protein, and pre-measured spices and seasonings you need. The culturally diverse recipes will include a grading based on difficulty level and clear, detailed instructions designed to build sustainable cooking skills. We did 2 rounds of prototyping and user testing with 15 users and used their feedback to refine our recipe, ingredients, instructions, and packaging. Customers can go to the Chop Chop website to view cooking tips, preview upcoming recipes for the following week, and provide feedback on our product. Unlike similar delivery meal kit services, Chop Chop will be sold at self-service kiosks in convenient locations where customers can quickly grab them on their way home as a healthy alternative to a frozen dinner or ordering a pizza. The kiosks will be interactive with a touchscreen interface and accept multiple payment options, including SNAP or food stamp benefits. These refrigerated, technology-enabled kiosks will allow for surveillance data collection and variable pricing based on location, time of day, and the shelf life of the product. Chop Chop kits have a handle for easy carrying on the go and are recyclable at the kiosk for a discount on your purchase.
So where will these kiosks go? There are 23,000 low-income residents living in the 18 census tracts highlighted on this map of Washtenaw County. All of these residents live more than 1 mile away from a grocery store. To target our customers living in towns like Ypsilanti, which is on the bottom right of this map, we plan to place our kiosks in high-traffic locations where people are making decisions about what they're going to have for dinner, such as transit centers. As we grow to additional locations like gas stations and community centers, including the YMCA, we'll be able to serve customers of all income levels and cross-subsidize Chop Chop to offer it at a lower price point to customers who have lower incomes. Our model is scalable, and we see tremendous opportunities for growth. In addition to geographic expansion within Southeast Michigan, we plan to expand our offerings to include things like lunch kits based on ideas and feedback that we receive from our customers through our website. Now, I know you're all wondering, how much will customers be able to buy these meal kits for? We plan to sell these meal kits for between $6 and $16, depending on the protein option being purchased, as well as the number of portions. This will result in an average revenue of $11. Each kit will have a shelf life of 5 days, and at the end of this shelf life, we'll discount products by $1. We estimate that each kit will cost $9 to make, resulting in a margin of $2. To keep labor costs low during our initial pilot phase, we plan to assemble and deliver these kits as a team ourselves. We've spoken to manufacturers of kiosks already and estimate that our first kiosk will cost between $6,000 and $7,000 to purchase. We intend to use Innovation in Action prize money to fund this investment. We know that there are risks associated with our product, and we want to acknowledge those to you. We've spoken to 2 successful healthy vending companies, including Human and Farmer's Fridge, and we're confident that we can mitigate against these risks. First, we're going to ensure we have a strong focus on operations. This will allow us to accurately predict demand and manage our inventory so that we're meeting this demand, but also minimizing wastage. Next, we're aware that competition is intense in this space. There are many companies trying to make cooking easier for our customers. However, options like Blue Apron and Plated require subscriptions and home delivery, which is prohibitive for low-income families who may not have the disposable income to buy these products and have unpredictable schedules. Options like Hamburger Helper or frozen meals aren't always nutritious and do not build sustainable cooking skills. Finally, we know that even the greatest ideas would not succeed without the right team, and we believe we have the team to make this idea successful. We're interdisciplinary, we have the right skill sets and expertise and background in project management, fundraising and advocacy, marketing, public health research, just to name a few. We've also already established relationships with the Washtenaw Food Policy Council and Food Gatherers Food Bank to complement our expertise and to have trusted partners in the community as we launch our product. Our vision is that Chop Chop will be what customers reach for the next time they haven't had the chance to go to the grocery store to stock up. By giving our customers new recipes and building their cooking skills, we hope to improve their health outcomes and change their habits when they do go to the grocery store. It's dinner time. Chop Chop.
Excellent presentation, really well done. You've done a lot of good thinking about the issue, the customer definition, the product you're developing, and sustainability models. Food deserts are a really important issue in public health. It's one that we've been grappling with for a while. How do we get food to the people where they need it? There are other models out there for doing this, mobile trucks that provide food to residents, and other types of options. Have you done a competitive analysis or competitor analysis to get a sense of what other options are there and what would make your option a better option for the consumers you're aiming for?
We've discussed that, and one of the things about our kit is that it builds sustainable cooking skills, and that's something that we really value in our kit, so that the next time that they go to the grocery store, we hope that they'll choose the healthy option based on the meal that we provided them. And that's something that mobile food carts or fast food options, frozen food, plated, doesn't provide.
Who go first? So I just have to first of all applaud you. For those of you in the back who didn't get a chance to see this, this actually instructs how you chop garlic. I was given a recipe to make something with an onion in the crock pot, and it said put the onion in the crock pot, and so I put the onion in the crock pot because I don't know how to cook. So kudos to you for doing that. My dish didn't work out. I have a couple questions which are all around tailoring and personalization. What about different sizes of families? So an older couple or a single mom with 6 kids, and then you can answer it in the same time. What about different ethnicities? So by zip code, a largely Hispanic or a largely Asian population, how are you taking that into consideration when you're thinking about the stocking of the kiosks?
I think that's a good question, and we actually spent a lot of time trying to decide how many servings to put into a box for that exact question. We decided to go with 2 and 4 to start, being that you could kind of piecemeal to a greater amount if you needed to. And what we ended up trialing in our prototype testing, this dish in front of them is peanutty quinoa, which is kind of more ethnic than some of the things that you might think would be on the shelf. So we have realized that people are open to those ideas. For tailoring by community in that way, I think it would require having more than the single pilot location, and by keeping data the way that we are planning to, we'd be able to meet that demand.
I think one of the cool things about the kiosk model is that we can collect data easily through that technology, and we'll be able to have a very direct customer interface through the website as well. So those two will help us tailor.
So what I like about the kiosk approach is one of the interests I had when I was reading about your project was, the food desert situation, it's like I don't have access to food, but also what it does to the economy when the supermarket comes to the neighborhood. So how it actually lifts the economy. So I was curious how that figures in, but the kiosk is really nice. First off, from a design point of view, I think it's really nice that you're identifying a third location instead of doing the competition of we're putting something else on the shelf. I think just as a business model, that's very interesting. I think as a product, that's very interesting. I'm going to ask, what are your thoughts on partnering? So on the front end, what are your thoughts on partnering, farm to table type things? And on the back end, what are your thoughts on partnering with, now you've set up these third places. Is it a model for not a standalone kiosk anymore, but also for like distributed health or remote access to health or daycare or something else that also solves a neighborhood problem? Have you thought of that kind of?
Yeah, so I'll start and then I can pass the mic if anyone wants to add. The kiosk model we first came up with that because we wanted this healthy option to be accessible in place of convenience stores and where there is no healthy food option already, so people can have that. But then it automatically requires partnership because you can't just put a kiosk on a sidewalk. You have to be in a building. And so I think that inherently we become a part of the fabric of the community, and that's really important to what we're trying to do to reach a customer that is most at risk for nutrition-related health problems.
From a food sourcing perspective, some of the folks that I've talked to are interested in, and they already do somewhat in this county already, kind of a farm feature. So this is all ingredients from a single farm. There's a lot of really cool co-ops and things going on in Ann Arbor. So being able to utilize their things and highlight this nonprofit farm is the food source for this meal. And also as a marketing initiative, because we were worried that some folks might kind of have an issue with buying fresh food out of a kiosk, having a restaurant highlight a recipe and have that kind of be a branding partnership as well.